My name is Chris. I'm with the Tampa Hillsborough County Public Library, and we're happy to have Rebecca McDonald with us tonight from the SHINE program. And this program is the Medicare Part C, Part D, and SMP. And I'm going to hand things over to Rebecca here, and I'm going to turn off my camera and my microphone. Welcome, Rebecca.
Thank you. Can everybody hear me? I hope. As he said, I'm a volunteer with the SHINE program. The SHINE stands for Serving Health Insurance Needs of Elders, and it's one of the many programs and resources that the Department of Elder Affairs has for Florida seniors. Our particular group, we're all volunteers, and we're specially trained in Medicare, and we provide free and unbiased counseling to Florida seniors so that you can make informed decisions about your health care. For people that are coming up on 65, you already know there's a lot of information out there. So we help you try to make some sense out of it. So Tuesday night we went over the basics of original Medicare Part A and Part B and optional coverage, which was Medigap. So this is one of the handouts that if you have the ability to, I believe it's in the chat box, these handouts, you can print it out and use it as kind of a reference. So just to review, we have talked about the left side or the left hand, which is your original Medicare, which is Part A, the hospital coverage, Part B, which is the medical coverage, and the Part B premium is $144.60 a month. And then optional with Part A and Part B is Medigap, which is through a private company that kind of either will pay the co-insurance or the deductibles depending on what kind of a plan you got. And we stopped at Part D, so we're going to cover Part D and then the Part C tonight. So you have the left hand, you can go and get your Medicare benefits that way, or you have the right hand or the right side, which is just a different alternative way to get your Medicare benefits. So right now we'll go ahead and discuss Part D, which is of course the prescription drug part of Medicare. It says optional coverage. It's only optional if you have other prescription drug coverage. If you've already got prescription drug coverage through TRICARE for Life, or you're have it through the VA or your retiree benefits or something like that, you do not have to purchase a Part D prescription drug plan. For those people that have no prescription drug plan coverage at all, Medicare really would like to have you have coverage. So for every month after 60 days that you don't have a Part D prescription plan, there is a penalty added to the premium that you'll pay when you finally do get a prescription drug plan. So if you have no drug plan, the least expensive runs around $22, $23, and most people they'll take that, and then Medicare's happy and you've got a drug plan in case you need it. So the prescription drug plans are through private companies. You do have to pick a plan and enroll in it. And that's done through Medicare.gov with it's a tool called the Plan Finder. But that's also what SHINE counselors can help you with. Make a list, put in all the medications that you're on, and then it brings up a list of all the drug plans that are in your area, and then you can go in and you can look at the prices and the copay and the premiums and the deductibles and whatnot. So every drug plan has a monthly premium, and it varies from plan to plan. And there is an annual deductible for drug plans, but it can't be any more than $435 in 2020. Some plans don't have any deductible. So when you bring up this list of drug plans that are in your zip code, you may see that one plan has a pretty low monthly premium, but it does have the $435 deductible. So then you want to look at the copays for your medications and kind of see what those look like. Then the next plan, it may have a higher monthly premium, but it might not have any deductible. So then again, you look at the copays. And so you have to do a little bit of homework and a little bit of comparison shopping there, because you want to, oh, that's a low copay, but they're going ahead and charging you the deductible, and then you have maybe higher copays for the drug. So you do have to kind of compare the thing. But the tool at Medicare.gov website allows you to compare up to 3 side by side. So it's what we use, and And if you can't figure it out, you give us a call at 1-800-963-5337 number, and I'll repeat that number again. But that's what we do. That's what we help people figure out. So there are co-pays for your drugs, and that varies by individual plan. So the main thing is when you're looking for a drug plan, make sure that all of your drugs are covered. Don't just buy a drug plan because it has a low premium or something like that, because maybe that your drug isn't in their formulary, and then you're going to be paying a lot of money for your medication. I'm going to just touch on this donut hole. It's not really such a big issue now, finally, because they've kind of closed the hole a little bit. And it really only affects people that have brand prescription drugs. Some of the respiratory inhalers and some of the insulin and stuff, it will affect them. But the phases of your drug coverage are, it begins in January, and you have, once you've met your deductible, then you move over to initial coverage, where most of us stay for the whole year, where you're paying about 25% of the drug for your copay, which of course, if you have generics, is like most often zero. If you use mail order, a lot of plans don't even put the lower tier drugs towards your deductible, so you may pay nothing. So all during initial coverage, they're taking the total cost of the drugs and putting it towards this $4,020. And once you hit that, and that sounds like a high number, but if you've got one drug that costs $2,000 or $3,000, it doesn't take very long to hit 4,000. Once you hit that number, you're in what they call the coverage gap, and you're still paying 25% of the cost of the prescription, brand prescription. So 5 years ago it was 50%. So it was really catastrophic for some people, but they've shrunk it down. So you're still is, if some of the brands, it's quite expensive, but all through that time they're still adding up the total number of drugs, and once it hits the number of 6,350, then you go into catastrophic coverage and you're paying a low price. So people that are on brand prescription drugs that are really expensive, they're in and out of the donut hole like on their first visit to the pharmacy on January 1st. So if you find yourself in this position, please again give us a call at 1-800-963-5337 and just leave a message that you need help with your drugs, or you're in the donut hole, and we have some limited resources that we might be able to help you with. But if you don't take any brand drugs, this isn't really going to be an issue for anybody. Is anybody, I think, are we good for drug plans? Okay, we'll move on. Hopefully we'll have time at the end for any questions too. So on
There's
your
no
left
questions
side,
at this
yes,
moment.
Chris.
I was going to say there's no questions at this
Okay, good.
moment, but
All right, moving on. So going back to that little poster, so on the left hand, we've discussed that you have your Part A, which is hospital, which for most people is premium free if you have any work history. You have your Part B, and that's all your medical, and the Part B premium is $144.60. At the very least, then you would also have Part D prescription, because to make Medicare happy, you want to have a Part D prescription plan. So maybe that's another $20 or $30 a month. And then some people elect to have a Medigap policy that pays the difference, the parts where Part B doesn't cover. So that's another monthly payment that you make to that private insurance company. Or you can go to the other side of the page, or the other hand, and get a Medicare Advantage Plan, also known as Part C. These are your HMOs and PPOs, and these Part C plans include hospital coverage, medical coverage, and most of them include Part D prescription drug coverage, all for the one low price of the Part B premium, $144.60. So you're going to be paying somebody something. You're either going to be paying Social Security is going to take your $144.60, and they're either going to pay it to original Medicare, or they're going to pay it to the private company that's taking care of your Medicare Advantage plan. It's not lesser care, it's just a different way to get your Medicare coverage. And it is through private companies. So like Cigna, United Healthcare, Aetna, Humana. So it's just a different way. You still have the same rights and the same protections as your neighbor that has original Medicare. It's sort of like one-stop shopping because it includes all the parts and it includes your drug plan. So on the right side, you're really only paying one premium, or on the left side, you're paying two or maybe three amount premiums a month. The Medicare Advantage plans consist of HMOs, which are managed care. You have a primary care doctor. You have a primary care doctor no matter what kind of plan, but with the HMOs, the primary care doctor is kind of the gatekeeper, so to speak. So the primary care doctor and the insurance company would have to give you authorization to go see a specialist. A lot of people are perfectly happy with that, if they know, give us 3 days notice or whatever, because the HMOs are usually the most cost effective for people. So you just can't decide to go make an appointment with your cardiologist. You have to call a primary care doctor and say, I think I need to see the cardiologist. And he's going to say, I think you do too, or well, let's try and treat you for a while. So as I say, some people don't like that restriction and some people are perfectly happy with it. The other kind that they have is called a PPO, or preferred provider organization, which you still have to stay in the network of doctors, and we'll talk about networks in the next slide. But in the PPOs, you still have primary care, but you can call and make the appointments with a specialist yourself as long as they're in your network. So with a PPO, you can call the cardiologist to make the appointment. Um, you still have the primary care doctor and all the reports still go back to them, but it's a little more expensive than the HMO. The copays, like maybe with an HMO, you would have zero copay for the primary care, and with a PPO, you might have $10 copay. For a specialist with HMO, maybe $15 or $20, and with a PPO, it'd be like $40. So the copays are higher, but you still feel like you have maybe a little more control over making your own appointments. You don't have to go through the referral process. So a lot of people find that to be just kind of a, halfway between choice kind of thing. Private fee for service plans, I don't even think we have any. I know we don't have any in Hillsborough County, and I don't know how many we have in Florida, but they're, you have the physician and the insurance company have a private agreement, and they know you have to call and find out how much to charge. So we don't really have them, so I don't talk about them too much. Special needs plans are HMOs for people with certain debilitating diseases like diabetes, respiratory, cardiac problems. So the special needs plans have enhanced benefits for those specific diseases, like with the diabetes one, maybe there's like no copay for the testing equipment, or they're just more tailored to those specific diseases, and they just have more benefits that, for that particular problem that those people have. And mostly it's people in lower income Medicaid to be eligible for the special needs plans. But if you have one of those diseases, it would be a good conversation to have with your primary care and say, do you think I could qualify for a special needs plan? And then they would be able to kind of direct you along there. So the Medicare Advantage plans, you do have to stay in their network of physicians. So you want to make sure that if there's doctors that you want to stay with, you have to call, and you're thinking about changing to a Medicare Advantage plan, uh, make sure that the doctors that you want to stay with are in that network. Just call them up. Don't try and bother with the physician directory because you'll have another birthday before you figure it out. Just call your doctors and say, I'm thinking about switching to Humana, Aetna, United Healthcare, whatever it is, the one that you're switching to, and say, do you accept that plan? And if they say yes, then you're good. If they say no, then that means you're not going to be able to go to that doctor. You can go, but you'll be paying out of network prices, and that's a lot, and that would defeat the purpose of trying to be a little more cost efficient with a Medicare Advantage plan. So Medicare, you have to have Part A and Part B before you can get the Medicare Advantage plan. But people that are turning 65, this is the decision. Which way do I want to go? Do I want to go the left hand with original Medicare, Medigap, and a drug plan? Or do I want to go with a Medicare Advantage plan? So that's where you can call a Shine counselor, and depending on what your lifestyle is, we can kind of help you decide what's the best option for you. Medicare Advantage plans don't travel well. You're good for emergency rooms and urgent care, but if you're going to be spending 3 or 4 months in another state, that's not, they're more locally, they're more regional. So if you're going to be traveling a lot, you may be better served by original Medicare, Medigap, and a drug plan. So that's all things that you have to consider about which path you want to take with your coverage. The premium, as I said, is $144.60. It's still the Part B premium because you have your Part B benefits included. So, as I say, you're going to be paying somebody something. With original Medicare, the Part B, you have the 20% co-insurance to pay. With Medicare Advantage or Part C, you have the copay. The thing about Part C is that you know going into it what your copays are going to be. You know that if you have outpatient surgery, your copay is going to be $150 if it's an HMO or $250 if it's a PPO. With original Medicare Part B, it's 20% of, and a lot of times that 20% of whatever, that's the unknown. So there's much less sticker shock with Medicare Advantage plans. Other costs is the co-pays, as I said. The nice thing about Medicare Advantage plans is that they do include, most all of them include limited vision, dental, and hearing. And Medicare has really given them a lot more leeway to add more benefits now. So many of them are adding transportation to the doctor's office, meals after, if you've been in the hospital, you can get meals at home. Um, what was the other one I read about the other day? I can't remember, but they're letting them, and they've expanded their telehealth services during the COVID problem that we're having now. So for somebody that's never had any dental coverage, you have to go to their network and their physicians. But if you've never had any of these coverages, then you know that's a pretty good thing. Medigap policies. Well, let me back up. Original Medicare Part B does not cover vision, dental, or hearing, and none of the Medigap plans cover dental, vision, and hearing. So if that's something that you want in your health plan, then you would seriously want to look at the Medicare Advantage plans. So, like I said, you have to stay in their network, but if you've never had it and you get it limited, that's good for you. Okay, Chris, how are we looking?
Yeah, we have one question.
Uh-huh.
Actually, two questions now. One person's asking about a book called Get What's Yours for Medicare. They want to know, have you heard of this book and is it accurate and useful?
Probably not. It depends on who's publishing it. If it's published by CMS, then it's like unbiased, or but it may be published by United Healthcare or Blue Cross or Humana, which is still going to explain the basic things, but it's going to be them wanting you to get their product. Best thing
Okay.
to do is to go to medicare.gov and look around on there, or you can request a copy of the Medicare and You handbook, which is everything that I'm talking about today.
Yeah. And one other question, is the premium for Medicare the same for everyone regardless of income?
Oh, no. Glad you mentioned that. Um, no, some people that are still lower income are at $109 simply because their Social Security checks haven't been enough to bring it up to 144. For some people that are high earners and for singles, it's like over $85,000, and I forget what the couples is, but they're high earners, or maybe you get a really lump sum, you sell your house and you got that money in your bank account, you're going to be paying more than the $144.60. It's based on your income tax return from 2 years ago. So whatever, if you had a lot of money 2 years ago, then you're going to pay a higher premium for a couple years. And then if your income drops because you don't have that big bulk of money, then you'll go back to $144.60.
Okay. Do you have time for another question? Or you want to move
I
on
do.
and we could ask
I
questions?
think I think we can, yeah, we're good.
Okay, so if you pick Medicare Advantage Plan Part C, do you still have to pay for Part B as well?
Right. You're paying the Part B premium no matter what you do. Part B premium is for your medical coverage, whether you get it through a private company, Humana, Aetna, United Healthcare, or you get it from whoever participates with Medicare. So yes, there are some companies that charge less. They're called give back plans. They're HMOs. if that's something you want to think about, you call a Shine counselor. We can discuss that with you. And some of the Medicare Advantage plans charge more, but you shouldn't really have to pay more than the 144.60 because I'm not really sure what they're giving you for that extra money. So if you're paying more than 144.60, make sure you know what you're getting. Like, yeah, I get a new pair of eyeglasses every 6 months or something like that. So I think that answered it.
Okay.
Okay.
That's all the questions
All
for
right, well,
now.
we'll try and move on here then. So how do you do
Oh,
this? Call Shine, 1-800-963-5337. The Medicare.gov website. This is your, it has everything I'm talking about tonight. Go there, ask its questions, tells you how to get a hold of us, and takes care of everything. Some old school people like me still say keep Medicare in the loop, or you can call the plan. You're going to call the plan anyways. They're going to, if you really know that you want to join Humana or Aetna or whatever, you can call and they'll send a representative out. But, try to make your, look at two or three before you do that. Um, Financial assistance programs, I'm going to touch lightly on these. There's extra help with prescription drugs, and this goes through Social Security. It is based on income and assets, but for people that qualify, the highest level of help pays for their Part D premium and gives them very low co-pays for drugs. So people that are having problems paying for their prescription drugs, this could be a huge help. And the other one is Medicare Savings Program. It's sort of like a limited Medicaid, and this goes through Departments of Children's and Families. Again, it's based on income and asset, but this helps people with the Part A and Part B premiums, and the highest level of help will pay that 20% co-insurance. Both of these programs, we have people that can help in our office. If you call that 1-800-963-5337 number and say, I need help, we have counselors that will actually help you fill the applications out and go through the whole thing with you and help get them mailed in and stuff like that, and we'll screen you for them. So if there's any question in your mind, if you're able to print down, download this and print it, this gives the income and assets for people. So if you're in the neighborhood of the limits, give us a call. Just say, I want to see if I'm eligible for any financial assistance. It's as easy as that, and it's a phone call. So if you're not, you're not, but if you are, it could be huge. So um, if you don't, just call. We'll be happy to help you with it. So nowadays we're hearing more about Medicare fraud and abuse. You remember you saw on our logo there was that SMP, that stands for Senior Medicare Patrol. We have volunteers within our volunteer group that have more training in the Senior Medicare Patrol. So they're the ones that take care of the complaints about fraud and abuse. So of course the difference is abuse is when it's billed by mistake and shouldn't be paid for. So give your provider a chance to correct the mistake. Don't just, assume right off the bat that they're doing that on purpose. At least give them a chance to correct it. Fraud is purposely billing for services that were never given or a service with a higher reimbursement. For office visits, there's several different levels of time that's to be spent with the doctor that they charge for different levels of service. So if you see the doctor's getting paid for, like a lot of money, and he came in and shook your hand and said, how are you? That may be something that you'd want to call a Shine counselor, talk to us about when you get your Medicare explanation of benefits. And if that's the case, then we refer you to our people with the Senior Medicare Patrol. But the difference, of course, is intent. And there's a lot of people out there trying to get your money. Prevention, detection, and reporting are the three things to remember with Medicare fraud and abuse. Medicare loses a lot of money every year, and if they're losing money to people that are trying to get it, it's not going to last so long for us. So the good thing is they finally got our Social Security numbers off the card, but you still have to guard your cards just like you did before. It's just, I only take mine out when I go to a new doctor. So I just, you want to guard it and guard that number carefully. Scam artists, it's a knee-jerk reaction when someone says they're going to take away your benefits, take away your Social Security, your debit card's not going to work anymore, and you just say, oh, here, take all my information. I just don't want that to happen. You have to stop for a minute and think, what are these people asking me to do? So you have to, really pay attention. And I understand because it's just a thing that we react to. Don't give your cards or numbers or anything out to people that aren't trusted sources. And everybody knows this, but when they call and tell you that you're gonna lose all your Social Security benefits, it's hard not to panic. So, and of course, don't sign any blank insurance forms. So, the way you find out things that are happening. Uh, if you have original Medicare, you'll get a Medicare summary notice. And if you have a Medicare Advantage plan, you'll get an explanation of benefits and just kind of look at those and see if that lines up with your calendar. Oh, saw Dr. So-and-so on this date. Yes, he got paid for that. But if you see there that somebody's getting paid that you don't recognize, then give us a call. I had a client that called and said, I don't know who these people are. Medicare paid them. And so I called Medicare, and it was the parent billing company for his physical therapy. So he saw something on that explanation of benefits that he didn't make sense to him. So he called, but it was perfectly legit. So he did the right thing. And it's as simple as that to keep people from doing fraud and abuse with Medicare. Report it, call Medicare, call us, call somebody, just make sure somebody finds out. Don't just say, oh, well, somebody else will take care of it. Any questions? Okay, so I do believe we have a little time for questions, if there are any.
We don't have any at the moment, but I
Oh,
will
good.
point out to our audience in the chat section, there are some links to the Senior Connection Center, some links to some additional resources, and also the phone number for Shine. So if you want to take a look in there, we do have that information in the chat section.
Okay, so that's good. I must have done my job well if everybody understands Medicare Advantage Plan. So again, they've given you the resources to contact Shine, and that's what we do. It's free, it's unbiased. We don't sell you anything. We just give you the tools to be able to make informed decisions about your health care.
There is one question that just came in.
Mm-hmm.
They're asking if you are on the Advantage plan and want to change your the question's not complete. If you can type that question in again, we'll try to
Well,
get an answer for you.
while she's
Get cut off.
typing, I will say that every year from October 15th to December 7th, we have what they call open enrollment period. So whatever decision you make is not written in stone, because every year we have a chance to change our plans. So if you signed up with a Medicare Advantage plan, and there's a couple if it's the first time with a Medicare Advantage plan, there's a couple things that you could, like a do-over that you get once a lifetime. But when it comes open enrollment and you think I would be better with original Medicare and Medigap, then you just call and change, and those go into effect on January 1st. So when the question is, did they finish typing it?
They said you answered it,
Yeah,
so
I know.
they're
I thought about that because I forget to get that in there about open enrollment. So, and we encourage people every year, even if you already have Medicare and your drug plan or whatever you have, is look at your plan and make sure that they haven't raised the price on some of your drug copays, or maybe you've got a new prescription that's not covered. And so it's sort of like car insurance, to look at everything once a year and look it over and see. We can quite often save people a lot of money by helping them to change drug plans, or even they're tired of that Advantage plan, they want to go to another Advantage plan. So you can change whatever you want during open enrollment, and it's fine. There's no penalties for anything like that. But if it's like your first year with a Medicare Advantage plan and you don't like it, give us a call, because there are some special periods that you'll be eligible for.
we don't have a question, but it is a comment. They say Rebecca is excellent. Thank you.
Thank you.
Oh,
Well,
we
I
do
hope you
have
have
one.
more answers than questions. And like I said, keep our number. And if there's, that's what we're here for. And we're just trying to make sense of it to people. So thank you.
There's one more question before we go.
Okay.
They want to know, do you know the most popular plan in Hillsborough, or where you can find this information? Yeah, where the information might be available.
I don't know if there's any information about the most popular plan. It's very individual to what, you can talk to your friends and neighbors, but remember, if your neighbor loves one plan, that plan may not cover all your drugs. It may not have all your doctors. So that's why we encourage you to go to the plan finder and then, look at the benefits for each plan. So popular, it's got to be more individualized than just being the most popular plan. There are some 5-star plans that are very good plans, so they're very good, but I don't think popular comes into it.
Okay. Well,
Okay.
that was a great. I was tell our audience really quickly. If you want to contact the library directly, you can call us at 813-273-3652. Staff will be available to help you 7 days a week from 9 a.m. to 6 p.m. Or you can go online to our website at hcplc.org/contact. Thank you so much, Rebecca. This was both these sessions were very, very helpful.
Well,
Very.
thanks everybody for listening. Thanks for having us.
Yeah. Have a great night, everyone.
Good
Take
night.
care.
Thank you.